Maya Getahun was 2 years old. On October 7, 2024, she was in the front yard of her family's home in Snellville, Georgia, when she was bitten by fire ants. Her parents recognized the danger immediately. They drove her to the emergency department at Piedmont Eastside Medical Center. She arrived with the unmistakable signs of anaphylaxis. Her breathing was labored. Her skin was covered in a spreading rash, her body reacting to venom in the way that medicine has known how to treat for decades. The treatment is epinephrine, intramuscular epinephrine, administered as quickly as possible. This is not a judgment call. This is a protocol every emergency physician learns before they ever step into a hospital. The staff at Piedmont Eastside waited more than 20 minutes. Anaphylaxis in a 2-year-old is a time-critical emergency. Every minute without epinephrine narrows the window between survival and irreversible damage. The medical literature is unambiguous. The protocols are written and posted and required. When Maya arrived at the emergency department, the signs were visible: breathing difficulties, systemic rash, a child in distress after an insect bite, a presentation that should have triggered immediate intervention. Instead, physicians and staff spent more than 20 minutes making the decision to administer a medication that should have been given within moments of her arrival. When Maya's condition deteriorated and the emergency room physician, Dr. Richiza Salazar, moved to intubate her, another problem emerged. There was no appropriately sized pediatric intubation equipment available in the emergency room. Staff were described in the lawsuit as scattered around the department, unable to locate the equipment they needed. An emergency room without the right equipment for the children it treats. Maya Getahun died that day. In April 2025, her parents, Bethlehem Getahun and Getahun Birhanu, filed a wrongful death lawsuit against Piedmont Healthcare, Piedmont Eastside Medical Center, and Dr. Richiza Salazar. The lawsuit states that her death was entirely preventable, that the failure to administer epinephrine promptly and the absence of proper pediatric equipment directly caused the death of a 2-year-old child who had arrived at a hospital that was supposed to save her. The attorneys representing the family also disclosed that Dr. Salazar had been named as defendant in 2 previous medical malpractice cases. Piedmont Eastside Medical Center has not publicly admitted negligence. Dr. Salazar has not had her medical license suspended. The wrongful death case is working its way through the Georgia court system. Maya Getahun would be 3 years old now. She was brought to a hospital for emergency care, and she died because the emergency room did not follow a decades-old protocol and did not have the equipment to treat a 2-year-old child. Her parents are in court, asking the question that the hospital should have asked long before that October afternoon. Why wasn't she ready for a patient like Maya? Subscribe to Case Files TV. Because a 2-year-old walked into an emergency room and never walked out, and someone has to say why.